Good day, everyone. My name is Fayzeh, a PhD candidate at Arabian Gulf University in Bahrain. It's a pleasure to present this research at the 8th IET Smart Cities Symposium, organized by the Institution of Engineering and Technology at the University of Bahrain. So today I am presenting my research enhancing medical student skills development, the role of virtual patient simulation tools. So here is a brief overview of what we will cover today. We will start by discussing the research gap objective, then move into methodology, findings, and recommendation. After that, we will conclude with a look at future work, including our plan at AGU. So traditional medical education method, while it's effective for foundational knowledge, often it fail in preparing students for like hands-on clinical practice. And mostly not only the medical education, but the traditional method always depend on like lectures, textbooks, and case study. So the limitation here will include like hands-on practical experience and also student engagement. Virtual patient simulation or VPS is an innovative solution that provides realistic and interactive learning, bridging the gap between theory and practice. So traditional method focus on theory but lack practical immersive experience. Traditional tools lack interactive experience needed for clinical decision making and engagement. Also, there is a limited development of culture competency, and interpersonal skills are very important also for patient care. Also, a very few studies exist on BPS in GCC countries, with only 3 found from Saudi Arabia, highlighting a need for regional research in this area. Despite VPS growing adoption worldwide, there remains a significant research gap in GCC countries. So this graph here illustrates the distribution of VPS studies globally, within the United States leading at 19% and Canada at 13%. Saudi Arabia is the only GCC country represented, contributing just 4.41% of studies. The remaining GCC countries have little to no research presence in this area. This lack of representation highlights the need for VPS studies that addresses the unique educational and cultural requirements of GCC region. My research aims to contribute to closing this gap, starting with the upcoming study at Arabian Gulf University. VPS integration into medical educations offer a unique advantage by enhancing clinical reasoning and communication skills, supporting engagement and improving self-assessment. So our study explores how these benefits can be maximized within the GCC context to prepare students more effectively for clinical practice. The primary objective of this study is to assess the impact of virtual patient simulation on medical student skills development. The focus areas will be enhancing clinical reasoning skills, improving communication abilities in clinical settings, increasing student engagement and interactivity, building self-efficacy in clinical decision making, and finally enhancing knowledge retention through immersive learning environment. So the research question is, how does VPS influence additional learning outcomes in medical education beyond clinical reasoning? The specific learning outcome was explored in this study is the student engagement with the learning materials, development of self-efficacy in clinical decision making, and also enhancement of knowledge retention, which traditional methods often lack. For the methodology, our methodology used a systematic literature review. So for the database, we searched through PubMed, EBSCOhost, and Scopus. The timeline included studies from 2014 to 2024. For the study selection criteria, of course, we included the studies that was focusing on medical students. The studies had a comparison between BPS and conventional educational tools, and we exclude the non-medical student studies and also the peer review paper. So the total article was found in the end was 137, and after removing the duplicates and the exclusion, 18 studies were included in the final synthesis. So it was found that VPS simulation enhanced clinical reasoning through the interactive scenarios. Also, students gain decision-making experience in various simulated medical cases. VPS included also specific patient scenarios aimed at improving the communication skills, and the focus area also included patient engagement, handling diverse culture context, and building empathy. So this chart here illustrates the comparative effectiveness of virtual patient simulation across three key skills areas: clinical reasoning, communication skills, and knowledge retention. Studies where VPS showed a positive impact, like in Group 1, demonstrate a notably higher effectiveness across all skills areas compared, of course, to studies with like no effect or minimum effect, like in Group 2. So as you can see here, for clinical reasoning, VPS in Group 1 was effective in 66.7% of studies, while for Group 2, it shows only a 29.6 effectiveness. For communication skills, Group 1 studies indicate a 44.4 improvement, within Group 2 lagging at 19%. So for the knowledge retention here, VPS impact was the most significant in knowledge retention, with an 88.9 effectiveness in Group 1, of course, compared to Group 2, which is 35.7%. So as you can see, these findings underscore VPS potential in enhancing practical clinical skills, making it valuable complement to traditional education methods, especially in settings requiring interactive learning. Also, VPS offers interactive features like tutorials, feedback, and reflection activities, support teamwork through debriefing sessions, and encourages activities participation. And for knowledge retention, VPS environments enable students to practice skills repeatedly in a safe setting, reinforcing knowledge retention. And also, reflective learning fosters the critical thinking and self assessment, aiding for a long term retention. This slide here summarizes the key findings of our research. So this chart here illustrates VPS effectiveness in various skills area, particularly, of course, the communication, knowledge retention, and finally the instructional intervention. Our analysis here shows that the structured educational methods such as tutorial, feedback, and reflection significantly enhance the learning outcome when it's integrated with the VPS. Also, the team-based activities like collaboration and debriefing also promote the critical thinking and improve the communication skills. So these findings demonstrate VPS potential to enrich traditional medical education by providing immersive and practical experience. VPS tools use different simulation modalities to create an engaging learning experience. So we have first person and third person perspective, and those will allow students to approach clinical scenarios from various angles, providing flexibility in learning. Additionally, interactive methods like the voice and text input as well as natural language processing will enhance the realism and encourage active student participation. So these advanced features enable the student to practice their clinical and communication skills dynamically, fostering both technical proficiency and interpersonal skills in safe virtual environment. In conclusion, VPS tools as a benefit, it improves medical students' learning by providing a realistic, controlled, and safe environment for skills development. Also, it enhances not only clinical reasoning but also communication, culture competency, and self efficacy. Also, as a complement, BPS is a valuable addition to traditional teaching methods. It improves the efficiency, immersion, and also interactivity of medical education. It equips students with the critical clinical competencies before patient interaction. So, to maximize the educational benefits of BPS, we recommended integrating these tools within the medical curricula to provide students with practical oriented training. Also, faculty training is very important to ensure that the educator can customize VPS scenarios to meet specific learning goals and make the most of these tools' capabilities. Culturally relevant scenarios are important as well, especially within the GCC, to ensure that training aligns with local patient care expectation. Finally, VPS should be used to provide continuous feedback, allowing students to reflect and self-assess their clinical skills in real time. Our research support also conducting further studies specific, like on specific VPS tools like BodyInteract, so which can offer insight into their impact on clinical skills development and communication. So, for the future work, long-term studies are very important, especially like to check VPS trained student into clinical practice to assess long-term impact. Also, evaluate the financial feasibility of wider VPS integration in medical program, and integrate advanced AI and AR to enhance VPS realism, and investigate the unique needs and impact of VPS within GCC medical education, with focus on specific tool as an example like BodyInteract. BodyInteract is a virtual patient simulation tool known for its immersive and realistic clinical scenarios. It allows students to practice clinical skills, make decisions, and engage in complex patient interaction, of course, in safe and virtual environment. Arabian Gulf University in Bahrain has adopted BodyInteract to enhance learning outcomes for medical students. So this tool is integrated into the curriculum to support hands-on skills development and promote confidence in clinical decision making. So for the upcoming study at AGU, it will be like a long-term study. Specifically, it will assess BodyInteract impact on clinical skills development, decision-making abilities, and also knowledge retention and application in real-world scenarios. So this study will provide a valuable insight into BodyInteract effectiveness, and also it will serve as the basis for second research paper on its role in GCC medical education. Thank you so much for your attention. I am happy to answer any questions or discuss BPS rules in transforming medical education, especially in the GCC region.